Do you know what abnormal vaginal bleeding means? These are red flags and it means you need to go and get checked out by a doctor. So the first is any kind of bleeding after the menopause, even if it's just spotting or bloody discharge, which means pink, red, brown, anything like that, go to a doctor. The second is bleeding in between your periods. We call this intermenstrual bleeding, and that means any bleeding outside of your normal cycle. The third is any bleeding that is much more painful or much heavier than normal for you. The fourth is bleeding after sex, and the fifth is any kind of bloodstained discharge when you aren't expecting it. Everyone's periods are different, but it's important to get these things checked out because abnormal vaginal bleeding can be a sign of multiple different types of cancer, including womb or endometrial cancer, cervical cancer, vaginal cancer, and even in some cases, ovarian cancers. Chances are it's probably not cancer, but we need you to just get checked out. Let's make sure that we're not missing something, because generally, the earlier that we catch these things, the better the outcome. Please do me a favor and share this video far and wide, because there are so many women who won't go and see a doctor immediately despite having abnormal bleeding red flags.